Hi, I'm Dr. Murali Krishna Naganla, consultant pediatric surgeon and pediatric urologist at Savani Multispecialty Hospital, Madhapur. Today I'm discussing about urinary tract infections in children and its surgical prospects. The urinary tract infections are one of the most common urinary tract illness in children. These are more common in the females than the males. So, when you see the surgical prospects, when you have to identify and detect some issue regarding the children, regarding the underlying surgical pathologies, whenever the male child have a single episode of UTI, or the female or girl child having two or more episodes of UTI in a single year, or three or more episodes of UTI in a two consecutive years, then we have to evaluate for the underlying associated surgical prospects or surgical illness or associated surgical anomaly. So when you come to the urinary tract infections has to be confirmed usually presents with the dysuria or burning micturition or the excessive cry with fever and loose stools. So when you do the routine microscopy, then you can identify the increased amount of pus cells along with nitrates positive, and on the culture you can have the identify the choroidal counts and the respective bacteria causing the UTI. So when you evaluate for the underlying physical illness, the basic investigation is ultrasound KUB. The most commonly associated surgical problem in UTI is the vesicular reflex. Normally, when you see the kidney and ureters and the bladder, the child having more than 2 years, the physical management of the vesicular reflex is the ureteric reimplantation. The scars are present. Most of the time, we do it by the either by vesicoscopic reimplantation or by the open implantation. But in this minimal invasive surgery days, we preferentially go by the vesicoscopy, that is by the laparoscopic procedure. We'll do it in 5 mm and to 3 mm ports. We'll operate do the reimplantation, same as the open reimplantation. So it has a successful rates of 95% in abolishing the reflex. Normally, if the child is medically managed, if there are no UTAs, it can have a successful spontaneous resolvement of the VUR by 5 years of age. Even if the VR is present beyond 5 years of age, it has to be managed accordingly by the surgical management, either by reimplantation or have to go by the XL injection according to the grade of reflex. So, another pathology which causing the urinary tract infections is the underlying PUJO. In PUJO, where the ureter joins with the inguinal pelvis is narrowed down, either by the abnormal musculature. So it happens, it causes obstruction. So the kidneys has dilate spontaneously and it progresses, and it is a source of urinary tract infection in children. So it has to be managed with the surgically, where according respective with the will do the DTPS scan or LLC scan nowadays. According to type of obstruction, we have to operate it. So when you operate it, we will do it by the laparoscopy. We will do the laparoscopic Anderson Hens pyroplasty, or if there is any crossing vessel thing which causing obstruction, we have to operate it with the same procedure by the laparoscopy. We can also perform it with the open, but the preferential go with the laparoscopic procedure. So, on the type of illness which is causing the urinary tract infections in children are the dysfunctional voiding. This is the most common entity causing urinary tract infections between 4 to 5 years of age children. This group. So, when you see this for children, the main causing of urinary tract infection is the constipation. When the child have the constipation, more chances of having the urinary retention and causing of the urinary UTIs. Why this happens is because of the common musculature or common liver triangle muscle and the nerves which control the both the bowel and bladder movements. So when the child have the constipation for prolonged time, then automatically child will develop the symptoms of the voiding dysfunction. There are various types of voiding dysfunction, but most common type which is occurs with the children is urinary retention. And urinary retention and leading to the urinary tract infection, because this is where the urine stores and it harbors the bacteria and it leads to the treatment of urinary tract infection. So how we'll treat this one is it is mainly managed both by a medically and by the habitual treatments. So how you diagnose it is by doing the urodynamic studies in the children, and also you have to treat by the history, and also treating the constipation itself can resolve the bladder bowel dysfunction or the voiding dysfunction syndrome. And in very small little bit of patients, we have to need treated by the pharmacological managements, where you have to give the children with the anticholinergics or the adrenergics, or alpha blockers. These are the most common causes of the urinary tract infection and surgical prospects in children. And there are very rarely and very rare things that can even cause urinary tract infections in children, like posterior walls, or the horseshoe kidneys, or the having ectopic ureters, or having uretrocysts. These are all things which has to manage by the lab, by surgical management. So if you consider the uretrocysts is having has to operate. It means the tip of the ureter where it is opening into the bladder is being ballooned out. So we have to treat it surgically by having a cystoscopy and the deroofing itself can treat the obstruction. Whereas in case of the PUV, there is an obstruction at the left at the junction of the anterior and the posterior urethra, where it causes it is usually present in the neonatal age group, having the children having the straining during the urine, passing the urine or the urinary tract infections. And these children can have the more added damage occurs because there is a significant obstruction occurring since the neonatal age group. So these children has to be treated by the cystoscopy and by the wall ablation. So these are all the surgical procedures which are used in the children with having the underlying pathologies which is causing the urinary tract infections. So I concise that whenever the child having the urinary tract infections of even a single episode in a male child and two or more episodes in a girl child in a single year, or three or more episodes in a two consecutive years warrants the under evaluation of the underlying kidneys, ureters, and the bladder to subsequent to rule out the any surgical illness causing the urinary tract infections.